I forgot what I was going to say. Okay, in this module we're going to talk about why evidence-based dentistry is important, and it's something that you need to consider in your own practice and in your future careers. So what do we mean when we talk about evidence-based dentistry? What is evidence-based dentistry? The first of these quotes is the quote that is the most often used in relation to evidence-based dentistry. So evidence-based dentistry is the conscientious, explicit and judicious use of current best evidence in making decisions about the care of individual patients. And so it's all about using the best evidence, so making sure that any treatment decisions that you make for your individual patients or for population health is based on scientifically sound evidence. So it's the best use of evidence to make a decision regarding a person's health care. And to do evidence-based dentistry, you have to follow a number of different steps. And these involve the systematic location, appraisal, and evaluation, and then implementation of the existing evidence in a particular area. So the important thing about this is that we're moving away from what we think is right, so what we think is right based on a hunch or previous experience with clinical areas or with particular patients, to what we know is right. So what we know is right based on the evidence out there. And why do we have to do evidence-based dentistry? Well, there's a number of key reasons. The first is that it's professionally and ethically right. So we need to do the right thing rather than something that we personally, based on hunch or clinical experiences, think is right. We need to do the right thing based on the evidence. There's also an ever-growing need for healthcare, but a limited amount of resources. So at the moment we have an aging population, people are getting older, and they're keeping their teeth for longer. And so obviously they need more healthcare. We don't have the resources to be able to treat everybody with the best existing treatments or interventions. So we need to know what is the best existing treatment or intervention. We need to evaluate technologies and interventions, whether they're new or existing. And so we know that what we're doing for individual patients is the right thing. Also, patients' expectations about healthcare have changed enormously over the last 10, 20, 30, 40 years. They think of themselves more as consumers rather than patients, and in this way they have certain expectations, not just about receiving care, but of receiving good quality care. At the same time, there's been an increase in compensation and litigation, and so what we need to do is to make sure that the care, treatments, interventions that we provide are the best, and we can only do this if it's based on evidence. So taking an evidence-based approach therefore addresses clinical effectiveness. We know what is right and whether it will work, and we know whether it will work for specific populations or groups or in particular contexts. It reduces the likelihood of adverse effects or complications because it's been tested, we know that it works, it's been evaluated. It allows for using scarce resources more efficiently because we can target particular populations that those treatments or interventions work for, or particular patient groups. It also offers a transparent means to keep patient expectations realistic. If you know that a particular treatment works, then you can tell your patients that. You can tell them that it's been assessed, evaluated, so it's based on good evidence. It also, as individual clinicians, provides a means for you to keep up to date with new techniques and interventions.